Great. So the webinar is now being recorded. So just keep that in mind in case you'd like to pose any questions or make any comments, that this will be recorded and posted on YouTube later. Again, my name is Tony Ochoa. I'm the Program Manager for National Latino AIDS Awareness Day at the Latino Commission on AIDS. I will be joined with my colleague Bolivar Nieto, who is the Deputy Director under the Capacity Building Branch of the Commission, who will be presenting on today's topic, which will be PrEP and Latinx. So we're excited to carry that out. Just to kind of review what we'll be doing today, we'll be doing some welcome and introductions in a minute, followed by some NLAAD announcement, and then we'll go ahead and do what we're calling Partner Spotlight, where we ask partners that are hosting or organizing events to speak about their event. So I'm excited to have partners lined up to speak about their NLAAD events in the next coming weeks. So with that said, again, my name is Tony Ochoa. What I'm going to do now, the lines are all currently muted. We put them on mute to kind of eliminate some of the background noise during the course of the webinar. What we like to do now is we like to unmute the lines just to kind of have a feel for one another as far as who's on the line with us and where they're from. So what we're asking you to give us is go ahead and give us your name, your agency or affiliation, followed by your city and state. So I'm going to go ahead and unmute the lines now.
The conference has been unmuted.
So everyone's lines are currently unmuted, so we can't hear anything you might say or have happening in the background. So again, we're going to give your name, your agency affiliation, your city and state. So my name is Tony Ochoa, the Latino Commission on AIDS, and I'm currently in Los Angeles, California, but the commission is in New York. So anyone can jump in and introduce themselves at any point.
John Murphy, New Mexico Department of Health, Albuquerque and Santa Fe, New Mexico.
Karina Escamilla from the Mexican Consulate, Ventanilla Salud Programs, New York.
Juan Carlos Owen, Elmhurst Hospital, Elmhurst, New York.
Mabel Martinez Monte from Downstate Medical Center, Star Health Center, Brooklyn, New York.
Maria Torres, St. Louis Effort Parade, St. Louis, Missouri.
This is Andy Mine. I'm at Marin AIDS Project in San Rafael, California, and I'm here with my new Latino outreach person, Fernando Barrera.
Alejandro Galeano, East Boston Neighborhood Health Center, Project Shine, PSR Program Coordinator, East Boston, Massachusetts.
Janice Hyatt, Regional
Program Director, New Hope Counseling Center in Texas.
This is Jonathan Fritz, Michigan Department of Health and Human Services.
Our mission is to provide
Dr. Montes, General Star Human Services, Long Beach, California.
Eddie Martin, Gilead Science.
Andrew Maldonado, Minority AIDS Coordinator for the Florida Health Department in the Cape Tampa Bay area.
Raquel Calderon, HHS, Boston, Massachusetts.
Alex Valencia, Supervisor of Education Specialist from ACQC, New York, New York.
Jorge Montes, Senior Health Educator, ACQC, New York, New York.
Ernesto Hernandez, LGBT Network in Long Island, New York.
Janice Hyatt, HHS, Region 1.
Sarah Garcia, Marin County Department of Public Health.
Eric Nava, Howard Brown Health in Chicago, Illinois.
Ton Nguyen, the Hedrick Martin Institute, New York, New York.
Charles and Brian Hollow from Nova Salud.
Kathleen Higgins, social worker at Elmhurst Hospital, New York, New York.
Oscar Salinas from Baton Rouge, Louisiana, Heart.
Philip Montalvo, St. Mary's Medical Center, Care Clinic.
Anthony Coyne, Team International, Washington, D.C.
Jorge Tagliaferro, Hispanic AIDS Forum, New York, New York.
Rodrigo Salazar, Houston Area Community Services, Houston, Texas.
Hugo Jimenez, Milwaukee, Wisconsin, Case Manager.
I'm doing the Love in the Sky.
Call today for an appointment to evaluate your heart disease.
Linda Dobra,
Marin County Public Health, San Rafael, California.
The webinar, from what the web platform tells me, there's 80 of us on the line. So we're excited to have the number of people on today's webinar. As you can tell, when the lines are muted, unmuted, there's a lot of background noise, so we tend to keep the lines on mute, which I'll do now again.
The conference has been muted.
Which makes it now a lot easier for us to hear each other, or actually for you to hear me. So what we'll do now, if at any point during the course of the webinar you have any questions, you have several options. You could either type your comment or question in the chat box, which you should see on your web platform, or you can raise your hand, and I'll call on you, at which point I'll ask you to unmute your line by pressing *6 or *7. So what I'm going to do now is I'm going to get started with the webinar topic. So before we get started, we want to do some announcements. On your screen, you see a question. We like to see a general feel as far as who's on the call with us. The intention of these calls is to do several things, is build the capacity of our partners in order to effectively work with Hispanic and Latinx populations. So as you can tell, we'll have a series of different webinar topics to do that. But it's also to kind of build a level of collaboration across our NLAAD partners. So the question I have here in front of you is this your first time attending an NLAAD network call? So go ahead and answer that question for us. And we have a good number of new partners on the call with us. And when I say partners, don't be scared or worry. I'm not meaning that you're joining a cult or anything. But when we say NLAAD partners, it's pretty much anyone that's interested in kind of collaborating or supporting the efforts that we put forward every year on October 15th for National Latino AIDS Awareness Day. So go ahead and let us know if this is the first time attending an NLAAD network call. And Oscar just asked a great question. Is it for this year? No, I'm asking in general if this is the first time you've ever joined an NLAAD network call. So I'm seeing a majority of the partners saying yes, this is the first time attending an NLAAD network call, which is great, because what I'll do now is quickly go over what NLAAD is about and who we are and what we do. So NLAAD is National Latinx AIDS Awareness Day. Some of you might have received invitations for our webinars or updates, and you might have noticed the Latinx. That's not a spelling error. That's a big change we've gone ahead and made this year as an effort to be more gender inclusive. Latinx is more than just syntax. It's an actual movement that's been going on predominantly in academia and a lot of social causes, which we decided to participate in. As we know, gender is no longer a binary. It isn't a binary. It's not male or female. So we've gone ahead and made this change as a response to a very masculine-driven language, which Spanish is. During the previous webinar, our colleague Michael Diaz explained what Latinx means. So I encourage you all to kind of seek it further and explore that as a topic of conversation. So again, NLAAD takes place every October 15th. And it's something that started back in 2003 in an effort to mobilize partners nationally. And a partner can be anyone from a student group to a faith-based organization to a church group to a large federally qualified health center to a health department. Anyone that's interested in participating and supporting National Latino AIDS Awareness Day by hosting an event, we consider a partner. So as you can see on your screen now, there's a series of pictures of different types of events that partners have hosted in the past in commemoration of National Latino AIDS Awareness Day. And the theme and imagery for National Latino AIDS Awareness Day changes every year. National Latino AIDS Awareness Day takes place on the last day of Hispanic Heritage Month, so it will always takes place on October 15th. And this year's poster is on your screen now, so we're very excited about this year's theme. This year's theme is We'll Defeat AIDS Con Ganas. And for those of us that might not be familiar with what con ganas means, it's a Spanish phrase oftentimes meaning having sufficient desire or motivation to act. So we went ahead and made the Spanish-English fusion of this year's theme, in which on the poster we showcase different action items that someone might take. Beyond just kind of having, a beautiful tagline, we want to make sure that people can find some tangible way of being a part of this cause. So on the screen you'll see an older woman having the tagline, I get tested con ganas. the young gentleman having I take PrEP con ganas, and the woman on the screen on the far right saying sigo mi tratamiento con ganas. So again, when we make a conscious effort of being as gender inclusive and representation of the Latino community as much as we can, and these are just some of the action items we could have listed, right? There's plenty of other ones, but I think these are the ones that were decided on based on feedback that we got from national partners, and also some of the guidance we got from our National Latino AIDS Awareness Day Leadership Council. So we're very excited about it. The poster will be available online. The website currently isn't available. As if you go to the NLAAD website, you'll see this on your screen now, which lets you know that the website's under construction. The website will be up and running for you to access materials like fact sheets and resource guides to help you plan your NLAAD events, as well as order posters and enter your event information and find other events on the NLAAD website. And that will be going live after USCA this year on September 19th. So keep an eye out for that. It should be live on September 19th. So a follow-up question is your agency, group, or organization planning an NLAAD event this year? So your options are yes, no, and not sure. So go ahead and select one of those options on the screen now, just to kind of, again, give us a feel and understanding of who's on the call with us. So a good number of us are saying yes, but a large number of us are saying not sure, which is completely fine. When we're saying organizing an NLAAD event, it can be anything from hanging up a poster to having a large scale cultural fair, or doing a health fair, or doing HIV screening or testing. Anything that is within your organization or group's capacity to do is a great means in which you can participate and support the effort. And we understand that sometimes we might not feel that on the actual date of National Latino AIDS Awareness Day, October 15th, is the best day to hold your event. We oftentimes have partners that host events on, after, or before NLAAD because, you know, we want to make sure that partners have ownership over their NLAAD events and let them find the best means to reach the community members they're targeting for their efforts. So don't be worried. You have plenty of time left to organize something for National Latino AIDS Awareness Day. If you're unsure of what you want to organize or how to carry that out, that resource guide I mentioned a minute ago will support you in doing that. So if you have any questions about that, that'll all be available on the NLAAD website, which again will be live on September 19th. So a little under a week on Monday. So what I'm going to do now, I'm seeing that the people that have their hands raised. We have Gatti. Do you have a question? If you do, you can press *7 to unmute your line. If you don't, Gatti, I'm going to go ahead and lower your hand, okay? And then I see Patricia also has her hand raised. Patricia, do you have a question? You can go ahead and unmute your line by pressing *7 or *6. Nope. Okay, well, I'm going to go ahead and lower your hand. If at any point you do have a question, but I've lowered your hand, you can answer that question or enter that question in the chat box. And I also have Eboniqua Milan with her hand raised. Eboniqua, if you have a question, you can go ahead and unmute your line by pressing *7 or *6. Guess not. I guess we're all getting a little curious with the hand raising feature again. So if at any point you have a question about what we're talking about, or you want to pose a comment, you can go ahead and raise your hand, and then I'll ask you to unmute your line. And then we'll go ahead and have that be the process so we don't have some of the background noise that we hear sometimes when we're moving to the content. So what I'm going to do is we're going to have the NLAAD Partner Spotlight. So at this point, for those of you that registered for the webinar, you noticed I've asked you if you're interested in kind of speaking to the NLAAD Partner Spotlight, which you've kind of developed the space on the call to allow partners to showcase what they're doing for NLAAD this year. So for this call, I have 3 people that will be sharing with us what they have planned for National Latino AIDS Awareness Day. One of them is Karina Escamilla with New York, New York, with the Ventanilla de Salud at the Mexican Consulate. Karina, can you press *6 on your phone to unmute your line? Hi, Karina. Do you hear me? Are you there, Karina? If *6 doesn't work, Karina, press *7.
Hello?
Karina? Hey, Karina.
Yeah. Hi, how are you? Are you listening?
I can hear you now.
Okay, perfect.
Welcome, and thank you again for sharing what you have planned for NLAAD. So why don't you go ahead and let us know what you have planned for NLAAD this year?
Okay, this year we have the National Health Week that is running from October 3rd to the 22nd, and then we have the 14th. We're gonna join the effort of with the city, like take the test with our mobile unit. We're gonna perform like looking for a train station to perform testing, and then also in the consulate on the 14th we're gonna be open to make the screening. And then in the 15th, that is the day, we have health fairs with Ecuador and Guatemala. So we are promoting that we will have screenings there with the National Health Week. They are going to have two fairs there, and then there will be a conference that we are participating with the city. So we have this 5 activities actually that we are like to be part of the day, awareness day, and so that's mainly the things that we are gonna do in these 2 days, and we are like looking for more organizations that help us to perform the HIV testings in all of these places. So as soon as I have, we know that it's a collaboration day, and then we were sure that we will reach a big amount of people, like making the test in the consulate, in the van, and in the health fairs within the other consulates, and with the people that came at the consulate. So that's mainly the things that we are planning to do, and then that's it.
That sounds amazing, Karina. Thank you so much. I think it's always great to hear when partners collaborate. So it's great to hear that the Mexican consulate is collaborating with all the consulates you just mentioned as far as organizing something for National Teens Awareness Day. We're also excited to kind of hear and see the Take the Train to the Test initiative come back. We did it a couple years back, so it's exciting to kind of see that carry traction again in New York City. And I'm excited to hear how it goes out. So again, if there's anything from here and then that you need support from us, don't hesitate to shoot me an email.
Okay, thank you so much for everything.
Thank you, Karina. Next, I'm going to ask Maria Iglesias from Fort Lauderdale, Florida, with the Florida Department of Health in Broward County, to go ahead and unmute your line. Maria, you can unmute your line by pressing *7.
I'm here. Hi, how are you? I'm Maria Iglesias. I'm the Senior Community Health Worker for the Florida Department of Health in Broward County. How are you? I'm member of Latinos en Acción. Latinos en Acción is an advisory group for the Broward County HIV Prevention Planning Council, and we have 2 events. We have one October 5, Wednesday, 2016. This is the Diversity Night. It's a trans fashion show and award ceremony. And we have another one is Saturday, October 15, 10 a.m. to 2 p.m. This is a health fair. It's Cuida tu Salud. We have information about medical insurance, HIV and STD testing, breast and cervical cancer, and more. This is the 2 events under Latinos en Acción.
That sounds great, Maria. We're very excited to see this happen. I know Latinos en Acción has been a long-standing NLAAD partner, so we thank you for all the work that you do, and we're excited to see how your event turns out this year. So again, the NLAAD Partner Spotlight was kind of developed as a space for partners to share what they have planned for NLAAD this year. Every year we have over 250 partners organize over 150 events throughout the country. So again, we really want to have a space for partners to really showcase what they do and all the amazing work they put into their NLAAD events. Again, part of what we do at the beginning of the webinar is, again, this is a platform to kind of build a partnership across the NLAAD network. But we also have what we'll be doing now, which is our webinar topic. We've had 2 webinar topics before this one, 2 NLAAD network calls. The first one discussed HIV/AIDS amongst Hispanic Latinx populations in the U.S. independent areas. The second one, which happened 2 weeks ago, was cultural responsiveness, humility and responsiveness when working with Latinx and Hispanic populations. And the one we'll be talking about today by my colleague Bolivar Nieto, who is the Deputy Director of the Capacity Building Division at the Latino Commission on AIDS, is Hispanic Latinx populations and PrEP. So with that said, I'm going to go ahead and pass the baton on to my colleague, Bolivar. Are you there? Can you hear me?
Yes, Tony, I'm here. How are you?
Great. So the stage is all yours.
Thank you, and welcome everyone, and thank you for being with us this afternoon and participate during this webinar. The way that I like to present this, it's actually based on a program that we designed aiming at bringing PrEP information for community members as well as organizations working with the Latinx community. So today, the different topics that we're going to cover is briefly how we have approached the design of these, what we call training of trainers for community-based organizations, as well as training of community members. The way we approach is to talk about and bring information about HIV in the Hispanic Latinx community. We are going to see how we address risk and what risk means, and also sexual networks. And then we talk about the different A's of structural interventions: acceptability, availability, and accessibility. And we added a few extra A's. One, it's awareness, and the other one is adherence. So we're going to explore whether PrEP is acceptable by the Latinx community, from the guidelines that were put out by CDC to what it actually means in terms of commitment, and also awareness. And at the end, it's intertwined with some surveys that we've conducted, as well as other research that we've looked in terms of the implementation of PrEP. So to start, HIV infection in Hispanic Latinos, this is something that it's part also of the National Latino AIDS, Latinx AIDS Awareness Day, and it's within the package that's going to be distributed. It's sort of like the updated numbers when it comes to HIV infection in Hispanic Latinos. So as you see here in the slide, as of 2012, 251,700 Hispanics are living with HIV, which represents 85.3%. And this suggests that there's 14.7% who have HIV and do not know it, and therefore our work towards getting the population tested, getting to know their HIV status. In 2013, about 209,073 Hispanic Latinos of any race were living with diagnosed HIV infection in the U.S. and 6 dependent areas, including Puerto Rico. Approximately 86% were male, 14 were female, and the leading transmission category for Hispanic Latinos was male-to-male sexual contact. So this we bring to the community to provide an overview of what the HIV or the state of HIV within the Latinx community, but also we go very local in terms of what's happening in whatever we are at that moment. As Capacity Building Assistant Division, we go to different locations throughout the country and we bring the local data to discuss it and talk about what this means in terms of the work that we need to do. The next part is to talk about risk, and we like to portray as a roller coaster. In my experience and the work that we've done and what I've heard throughout the years in different locations, it seems to us, and in discussion with different programs here, that risk is taken sometimes as a constant, and that there are no changes. But if we look at, for example, Lewin's equation, which is an equation about motivation, that then can be transitioned into what we know now as the social ecological model. Behavior is a product of the person in a particular environment. So if we're talking about the environment, we're talking about society and policies, we're talking about communities, we're talking about relationships, and we're talking about the person. So all these different things impact the individual, which may lead them to a particular behavior. So risk, it's not necessarily a constant. It changes with time. It changes with the environment. It changes with the predisposing characteristics that may influence an individual, including, for example, peers, peer communication, or it could be about, for example, testing, how fast the test is, or how confidential tests might be, so I can get tested and so forth. So our behavior it's a function, as they call it, of the person or the person characteristics and the environment. So risk is therefore not necessarily a constant. Then we bring the conversation to talk about what sexual networks mean and risk. We provide a definition that risk networks or HIV transmission networks talks about these networks where there are some characteristics that facilitate HIV transmission. Obviously, it includes HIV incidence and prevalence, geographic region, and a specific community, the specific network sexual behavior, whether it's condomless, whether it's using condoms, the HIV status, and the social determinants of health. Again, it's to, in a way, narrow down what networks means in terms of the person and the environment as it leads to a particular behavior. This is an exercise that we conduct with participants, and we bring the conversation not only about not knowing your HIV status, but those who are HIV positive and are on antiretrovirals and are undetectable, and what that means in terms of risk. So this is the first component when it comes to bringing information on what HIV, the state of HIV in Latino, Hispanic communities in your local environment, what risk is, what sexual networks are, and how this impact or and how you can assess your own risk. Then we move the conversation to what PrEP is. And brief overall information is a strategy that changed the field. It changed, modernized what we know as HIV prevention, and we like to call it an intervention that is using right now a pill as a tool, as part of this intervention that provides protection from a possible HIV infection. So we highlight PrEP as an overall intervention that is going to include medical appointments, tests, the pill as a tool for now, adherence, and a lot of other key resources that are needed to effectively adhere to this new option in terms of prevention. So the question is PrEP for me? And according to the National HIV/AIDS Strategy Update out of 2020, we look at the right people, the right places, and the right practices. PrEP is included within the right practices. And one key component here is that it states that it's full access to PrEP services for those whom it is appropriate and for those who desire it as well. So appropriate defined as CDC says PrEP is for people without HIV who are at very high risk for getting it from sex or injection drug use. We're going to see some federal guidelines that recommend that PrEP be considered for people who are HIV negative and in an ongoing sexual relationship with an HIV positive partner. But it also includes that that it isn't a mutual monogamous relationship with a partner who recently tested HIV negative, is gay or bisexual man who has had anal sex without using a condom or been diagnosed with an STD in the past 6 months. Heterosexual man or woman who does not regularly use condoms during sex with partners of unknown HIV status, who are at substantial risk of HIV infection, people who inject drugs, and are and it's being considered getting pregnant with HIV-positive partner as well. So this is sort of like the guidelines that summarize who is PrEP for. As we see here, is for men who have sex with men, heterosexual women and men, injection drug use, as I just explained, and who are clinically eligible. And this is sort of like the component that we'd like to talk a little bit more, because it's about a documented negative HIV test before prescribing PrEP. So that means test needs to happen before, and that it's done either by a community-based organization and or where a test is provided. No signs, symptoms of acute HIV infection, and other components when it comes to be clinically eligible as per these guidelines. The guidelines recommended for MSM for PrEP use, you see them here: an adult man without acute and established HIV infection. So if I repeat a little bit the clinical eligibility, but it also talks about not in a monogamous partnerships with a recently tested HIV negative man, which I just mentioned before, and at least one of the following. What we like to highlight here is to get from participants what is understood with an established HIV infection and what is understood by any diagnosis or report of an STD in the last 6 months. It's a little bit what I mentioned before in terms of knowing your HIV status, regularly tested or getting tested. So it's part of this overall strategy or intervention, as I call it. Then we go into what is the regimen and adherence, which is part of the PrEP therapy. We like to emphasize this part as well to, one, get information on what's understood by regimen, and two, what's understood by adherence. We provide some information in the differences between the two, regimen being something that is prescribed, is a medical treatment, it's a form of life, it could be a diet. That's sort of like the description of what a regimen is. In this case, a regimen for PrEP, it's once a day take this pill, and again, every 3 months go and get tested, and so forth. The adherence part is the sticking to it. And this is something that we like to emphasize quite a bit, not only when it comes to those who are negative and seeking to potentially go into PrEP, but those who are also HIV positive, and how adherence is key when it comes to treatment as prevention. An article that was published in 2015 in October, that it's about pre-exposure prophylaxis related stigma and strategies to improve the uptake and adherence. In their conclusion, they suggested that good adherence to PrEP is absolutely critical to its effectiveness at both individual and public health level. And adherence may be compromised in situations where there's a need to conceal PrEP use. So this is something that sparked our curiosity in terms of stigma that may be associated with getting into this intervention. It is also important because we suggest that PrEP requires commitment, the health requires commitment. The adherence part is not only to take the pill every day, but the follow-up visits, the the ongoing tests, the constant access to behavioral interventions, because again, behavior, it's not just about the person, but it also has to include the environment, and risk is not a constant. At any moment in 3 months period or 6 month period, things can change for an individual, and so can risk. So there are barriers, and the barriers is what we call, and we bring the conversation around the different, the 3 A's of structural interventions. A range of authors noted that there are lessons to be learned about PrEP uptake and adherence, and the role of stigma from studies done on antiretroviral therapy in people with HIV. Also, the stigma related to PrEP does not exist in a vacuum, but is produced by social pressures that also stigmatize HIV infection and non-normative sexualities. Part of the component of the Preparándonos intervention is that we approach the conversation around sexuality and the sex-positive approach to talk and to assess and to self-assess what risk may mean for each one of us. We conducted, for the barriers part, a survey together with the presentation that we created. One was a provider survey, the other one was a consumer survey. In this survey, we ask about knowledge, we ask about attitudes, we ask about availability, accessibility of PrEP. Around 88 people participated in the survey. The majority of the participants, 77%, were male, and 90% were self-identified as gay. Between the ages of 20 and 39, 70%. The majority self-identify as Latino. We were not using Latinx back then. And opted to complete the survey in Spanish, 85%. So we do it both in Spanish and English. Their HIV testing history and status, 61% of the participants reported their status as HIV negative, while 35% as positive, and 3% did not report their status. Half of participants have been tested within the last 6 months, and almost 20 had been tested over 6 months, 20%. In terms of risk factors of participants, 3 items on the surveys were used to measure level of risk behaviors using a 5-point Likert scale. And on average, participants did not report alcohol use at last sexual encounter and had been taught about HIV/AIDS. Participants were neutral to someone in agreement with one statement: I use condoms for all my sexual encounters, indicating possible inconsistencies when it comes to condom use. So some of this information, again, this was done in New York, Miami, San Juan, Puerto Rico, and California. Chicago were just surveys. The other ones we actually provided the training and the survey at the same time. So the way we like to divide this is based on awareness, acceptability, accessibility, availability, and adherence. Without awareness, we may not impact acceptability, as we're going to see, or accessibility or availability. Without accessibility and availability, adherence may not happen. So these are connected. Overall, the results of the survey indicated a moderate level of knowledge about PrEP. So when we talk about awareness, moderate level of knowledge, it's a good outcome, although we wanted to get a little bit more than moderate. So this suggested a lot more needs to be done in terms of bringing this information to our communities. So it can be improved with educational campaigns targeting risk harm reduction techniques, eligibility, and awareness of PrEP. When it comes to acceptability and PrEP, HIV-related stigma has been shown to negatively impact HIV testing, status disclosure, and treatment. Many individuals report feeling stigmatized for being on PrEP. Doctors appear judgmental about their decision to get on PrEP and are unwilling to prescribe it. Guilt and lack of social support are key figures can affect PrEP uptake and adherence. One of the things that usually come is this idea of recompensation, which is actually one of the fears from providers that we've seen. That means that if individuals are going to be taking PrEP, that means that condoms may not be used anymore, or sexuality is going to increase, and so forth, which is being non-existent in additional studies. There's no more or less risk compensation in the uptake of PrEP. So there's another one that for Black and Latino MSN, we're more likely to regard having to talk to their doctor about their sex life as a barrier to PrEP. So acceptability, this is what we ask our community. We ask them if they believe that taking PrEP is taking unnecessary risk. We ask them if they believe that PrEP is immoral and promotes promiscuity. We ask them what will the doctor's reaction would be if they were to request PrEP, and what will the community say. And this is aiming at the social support, the closeness, social support, friends, family, even sexual partners, if they knew they were using PrEP. As we saw before, stigma was very associated with the idea of someone knowing that you were taking PrEP. So that creates a barrier to potentially either continuing with it or accessing it. In our survey, we measured these attitudes using the views of PrEP in relation to themselves. And on average, participants remain neutral when asked if they saw themselves as eligible for PrEP. There was an agreement with starting PrEP in the next 3 months. There was discomfort with PrEP in terms of using same medication as HIV-positive persons. Discomfort with others finding out. So this was more aiming towards question or number 4 that we have here in terms of acceptability. So if acceptability is not there, and we've seen from other research findings in terms of implementation of PrEP, the Black, African American, as well as Latinx MSM are not engaging or not actually seeking to start or are on PrEP. And it may be all these determinants of health that are impacting, one of them being stigma, the other one could be social support, the other one is sort of like your healthcare provider. So one of the topics that I bring to this is the idea of power distance. So power distance, social construct that it describes how people belonging to a specific culture view power relationships between individuals. There's a scale or an index on power distance. There's high power distance and low power distance. When it comes to high power, this means a differential to figures of authority and generally accept an unequal distribution of power. Low power, on the other hand, questions authority and expects to participate in decisions that affect them. So this is what what can we do to impact power distance? That means lower it and quote unquote empower And I use quotes because it's not that as a community there's no power. It's just that because of different cultures, we may see authority differently. And when I call authority, I'm talking about service providers in terms of doctors, in which the war it's what it is, and there might be no questioning on it. And for this conversation around sex and HIV risk reduction, there has to be this negotiation, I will say. There has to be this question of authority, and we need to participate in the decision that it's going to impact us. So if we look at an example of the power distance index, we see the U.S., for example, is at the lower end, however, Latin American countries are at the higher end. And from personal experience, it's interesting to see, for example, friends that I grew up with in Ecuador, went to high school with, and we are now all together on an application, exchanging ideas. But those who never completed college versus those who completed college, even though we grew up together since we were 7, those who are now doctors are regarded as doctors, not as we knew them before. And there's this switch in power dynamics that's happened between us, between those who've completed college and have a profession and have an additional initials added to their names versus those who didn't. So I've seen this power distance enacted and how we are regarded, even though we know each other. And this happens a lot when we talk about not disclosing our sexual history. As I mentioned before, in a study, Black, Latino, MSN were not likely to regard having to talk to their doctor about their sex life, and they see this as a barrier. So we want to see whether there's this power distance happening and how we can change those dynamics to maybe impact acceptability of this new prevention method. The other part is, where do I get it? So we move to where do I get it? And there are different questions about this component, specific as to how much it's going to cost me. We've divided this into availability and accessibility. So we start with accessibility from the consumer part. Issues around cost and awareness can limit access to PrEP for certain population. Prior knowledge of the drug appears to be one factor related to its uptake or lack thereof. We were talking about being a part of antiretroviral therapy for those who are HIV positive. So this may be the prior knowledge impacting that accessibility. The frequent copays, lab work can make PrEP uptake and retention difficult for some. So here's the adherence part in terms of accessibility. From the service provider, silence exists between healthcare providers and their patients regarding HIV risk. Again, we're talking about the conversations around sexuality, sex, risk, and the cost of an intervention includes not only financial costs, but also the time and effort required to maintain it. So these are the problems when it comes to accessibility and PrEP. The availability. The availability deals more with the adequate clinical capacity and delivery of PrEP. Again, information around PrEP, what it is, how can I get it, what may be the side effects, if any, how long do I have to take it, answering and sort of like doing an assessment on how adequate this particular provider is with regards to PrEP. how knowledgeable. But that comes again with that idea of being able to question certain situations that may happen, being able to sort of like challenge that authority. The unknown availability of PrEP is in most communities again. Many do not know that it's available. It may be in locations in which it's still not, we're still talking about, yes, condom is still part of the combination prevention approach, but PrEP is not necessarily mentioned because it might be taken as, my community is not interested in it, or again, the other questions about community, why, people may feel that mentioning this, it's promoting certain type of sexuality and so forth. Availability of lists of PrEP providers has changed a little bit. There are more lists, depends on where you are. New York certainly has it, and other locations. But this changes when it comes to the comparison between urban areas versus more rural and suburban areas. So again, what's the availability, the accessibility to it? And concerns regarding the increase in non-prescribed use and sharing of medication between MSM. And this is something that we want to explore a little bit more in terms of whether if this is happening more often in Latinx communities. As a review of the information that we are presenting here, it was part of how people were using it. And when I talk about people, it's not specific to Latinx, but it's something that we would like to explore more in terms of availability. As a sort of like putting it all together is who's offering it. So be aware of the capacity, the information, the history of the location that is offering, how it's being offered, and how is the communication in terms of PrEP beyond just the pill, but PrEP as the intervention, and what comes with it in terms of behavioral interventions, in terms of structural interventions. One of them is testing and condom accessibility. How much is it going to cost? Other questions that are related to definitely insurance and co-pays. Here we provide some information that we have in terms of accessibility, websites. There are other very specific for New York City, but since this is a bigger platform, it's about who is offering, how it's being offered, to whom it's being offered, what are the interventions that come with it. So because we believe that PrEP is a not one size fits all, so we like this idea of HIV prevention options. And when we talk about HIV prevention options, we talk about the prevention toolbox. And the way we see the prevention toolbox is that with information, with knowledge, we can be, and again, empower, quote unquote, to develop our own prevention method, something that best works for each one of us, something that takes in consideration the environment that I'm in, that provides me the education about my options, the combination of options that shows me how to assess my own risk, when I'm a good candidate for PrEP, when I'm not, get tested for HIV, STDs, Hep C, So regular doctor's visits choose what works best for you. It could be condoms, it could be PrEP, it could be both. Again, this depends on how the person defines their risk, and this definition is based on knowledge and information. And then support services, medical, social, and other that address the environmental factors that may be impacting behavior. As we saw, some of the hesitation comes from what my doctor may think, what my community may think, what my family may think, what others who I'm going to engage in sex will think. So the best advance is having more options for HIV prevention. At the end, this is sort of what we do as Preparándonos. We have defined this as a community mobilization program of the Latino Commission on AIDS, whose mission is to, reduce that power distance in our community so we can participate in an informed way in conversations about HIV and health with friends, families, health providers, overall community, and participate in the decision-making process about my prevention methods, something that best works and adjusts to the needs or my needs and my risks. So this is available, and it was for different organizations. It was a collaboration between the different programs here at the Commission, from direct services programs, which is the Access to Care, to our regional program that is called Latinos in the Deep South, Puente para la Salud, or Bridges to Health. To Health is a local program that works with medical service providers, and of course the National Latinx AIDS Awareness Day. And that concludes my presentation for today. Thank you, and Tony?
Great, Bolo. That was amazing. Again, it's always kind of great to see this carried out and to see you adapt it from a training of face-to-face interaction to a webinar. And I think one of the major things to take away from us carrying this out, I was actually part of the process where we did the training here in Long Beach, California. And I think it's interesting to say that the fact that we put it in this model of the 3 A's, acceptability, accessibility, and availability, what we saw from city to city as far as how this carried out was drastically different. We went to regions where we saw that in the South there was a heavier focus on how do we make PrEP more available to undocumented immigrant populations, right? And that unpacked a series of different strategies that are very different from what we might see in the Northeast, where we see a very different type of population. Mm-hmm. So when we talk about accessibility and availability and acceptability of PrEP, it really does vary even amongst Latino populations, right? So thank you for that. So what I want to do right now is I'm going to go ahead and see if anyone has any questions or comments to make about what Bolo just covered when we talked about Latinx populations and PrEP. So what you can do is raise your hand if you have a question, and then I'll call on you, and I'll ask you to unmute your line, or you can enter your question or comment in the chat box. So Oscar Salinas has a question. Oscar, you can unmute your line by pressing *7 or *6.
All right, can you hear me now?
Yes.
Hey, Oscar.
Okay.
Oscar?
Yeah, I do have a question in reference to the population that you serve usually as a part of the clientele that you have. Because what we have here in Louisiana, I'm calling from Baton Rouge, Louisiana. What we have in the PrEP clinics here is usually white, gay, male, well-educated population coming into the PrEP. But we don't have the actual at-risk population, youth MSM of color, young adults, Hispanics. They are not coming. So what is the suggestion or recommendation utilizing this kind of training or awareness? Besides to that point, if there's any way to get more support in that, that's actually a question and a comment at the same time.
So I'm glad you brought that up, Oscar, because this is exactly why this curriculum was developed. It was developed for us to collaborate with partners locally in different jurisdictions so we can strategize around addressing those barriers you just mentioned. And that isn't something that's specific to Louisiana. As far as PrEP uptake goes and interest goes, we see that it's heavily needed amongst Latino populations, Latinx populations, and especially those that are very high at risk. But there's a series of barriers that we encounter as a Latinx population when it comes to addressing those or overcoming those barriers. And those are very different based on region. I'm pretty sure what it would look like in Louisiana would look very different from what it would look like in Los Angeles. So we created this as a building block to strategize on how we can make a PrEP accessible depending on the region it's being implemented in. So if you want to kind of develop a more coherent strategy specific to what you're encountering at your PrEP clinic, we would love to carry it out with you and have discussions around that.
Well, absolutely. I would be more than happy to connect with you after this and tailor something and maybe customize something for this kind of service in here because, I mean, apparently we are not accessing the right population. Well, no, I wouldn't want to say the right population, but we are capturing some at-risk population, but not based on statistics to those who are actually a highest risk category. We're not included. They are not coming. What can we do different? Just to be short in my comment again, we don't have any Hispanic, for example. We don't, period. The Hispanic population that we have on PrEP is basically, some of them, curiously, is that I know is a couple of transgenders. Mm-hmm. And then the Hispanic population is very limited into PrEP, and mostly is white, gay male, well-educated. Those who are coming up front easier and more willing to get into PrEP.
Of course, and that's common. Again, part of what Preparándonos was developed for was to kind of build the capacity of our community members to be able to have a voice in decisions like this. I mean, one of the starting blocks when it comes to making sure that PrEP is accessible and used is making sure that people are aware of it. So our effort is to definitely raise awareness around PrEP so that we can have more different conversations about accessibility and affordability and things like this and adherence when working with Latinx populations. So thank you for that. We definitely look forward to connecting with you.
And as a national capacity building assistance provider, we can definitely work with all of your organizations to sort of see what's the particularities, because there are particularities, and then adapt, see how this may work or how this can work within your location.
Definitely. Great for that. Good combo.
Great.
Any other questions or comments?
Thank you very much.
Again, you can enter them in the chat box or you can raise your hand, and I'll go ahead and call on you to tell me your line. Great. I think, Bolo, you did an amazing job. One of the highlights, I think, for us to really consider is how PrEP is accessible and available and acceptable depending on who we're engaging, right? The way in which we would engage a young MSM who is gay identified, who has, the resources as being a resident or citizen would be very different from someone that's a migrant worker that's undocumented as far as the navigation they would have to take to be able to access PrEP. So again, it's important for us to be mindful of those things. And it's great that there's resources and we're here to support you in making sure that we can carry out ways to figure those out. Brian, I see you have your hand raised. You can go ahead and press *6 or *7 to unmute your line. Are you there?
Hello?
You can press *6 or Brian? You can press *6 or *7, Brian.
Is it working now? Can you guys hear me?
Yep, I can hear you now.
Okay, perfect. So I'm the PrEP manager at Howard Brown Health in Chicago, and I meet with a lot of different patients who are needing PrEP accessibility. We do a lot of PrEP navigation and PrEP case management for new funding opportunity that we got through the City Public Health Department. But primarily my concern lately has been that in trying to reach a lot of the populations that are trans, obviously hormones and transitioning is a very big aspect of their health care. But I've been running into the challenge of a lot of the Latinas who, because primarily the trans folks that I meet with are when they're of like Latinx, a lot of them have been like trans women, and they've been wanting to start PrEP, but they get really concerned about what possible interferences there are between PrEP and the use of hormones at the same time. And for the most part, I mean, clearly there's like more research that needs to happen on this topic. But we're also running into the concern of them because like transitioning is really important. Like it's a very important healthcare need that they have. Because of the worry that there would be complications, they'll stop using PrEP. And continue hormone use because they'll say, I just don't want that many things in my body at once. And so I'm wondering if anybody else is kind of running into that issue with trans populations like stopping their PrEP use or just like stopping use of PrEP because not necessarily that there is an actual indication between issues of those two medications being taken at once, but just the patient feeling that there is that's going to happen and then stopping using PrEP even though they continue to have risk factors for HIV.
Great. That's a great question, Brian. I'm going to go ahead and repeat that. I think some people might have had a difficult time hearing you. So you're mentioning that in the populations you work with, which predominantly have been transgender Latinas, you've noticed that there's been a drop in uptake or adherence due to the fact that they feel there might be an issue with taking PrEP along with hormone therapy. So your question was, are there any other communities that you feel, are any other people on the webinar with us today encountering something similar? This is actually new to me, so I'm glad you brought it up. It's something that I think I would love to explore further. Because I haven't heard much of that myself. So does anyone else want to share or have comments about how they might have had a similar experience with working with transgender communities? If not, Brian, I want to look more into that for you and definitely have a call with you after this call. Maybe a one-on-one to see how we can address this.
Yeah, that'd be great. Thank you very much. I appreciate the support.
Yeah, but I agree with you. There aren't. I haven't read anything that says there are interference or interaction between hormone therapy and PrEP. So I think this would definitely be an area for potential awareness and addressing that particular issue. That becomes a concern that we start seeing more and more. I would definitely let's collaborate to see how we can work with that.
Yeah, thanks. And I think that might be a greater concern. Or that might be a concern for the greater Latinx community that, that they're like, what is this going to do to my body and things like that. And there's a lot of those challenges that we've met with patients who have those concerns and like how to address them correctly, like from a medical and scientific standpoint, but also being, culturally aware that, that this isn't, that this is a concern for the community and that we need to address it in the most, appropriate way.
Definitely, and I think sometimes one of the best things we can do is kind of consider how cultural differences come into play when it comes to raising those concerns. So yeah, I'm with you.
Thanks.
So Emily here has a comment. She says, we have several HIV positive patients that also need PrEP education. I've spoken to some who have come in asking if they can give PrEP to their partners hours after sex. I've explained to them, to a few, that for PrEP to work, it is a commitment to taking it every day and coming to checkups every 3 months. So there is a lack of correct information out there. So I think, Emily, what you're addressing is a very great comment to bring up. There have been, and I think there might be some overlap with some of the current studies that are being conducted around PrEP uptake. There are some studies that are coming into play right now, which are called kind of PrEP on demand. Which are and currently being done, where it kind of tests the effectiveness of PrEP if taken rather than regularly or daily, to be taken on demand, meaning right before a particular act, during and then after as well. So there's definitely studies out there that are kind of testing for that, but there's nothing to say that it's okay to do that now. But it is happening. I've from research and kind of conversations with partners, we've noticed that this is happening pretty widespread. So I think that's another area in which we can kind of have grander discussions, not only within the Latinx populations, but also other populations as well. But yeah, it definitely brings up a concern around, PrEP on demand and what Bolo was talking about how we can make this more acceptable when it comes to adherence.
And I think it should be part of the combination prevention approach that is for HIV positive individuals to bring this information about what PrEP is, how it works, the commitment, and so forth.
Great comments, guys. If there aren't any other comments or questions, I'm going to go ahead and close by asking you one last poll question, and that's the kind of, we want to make sure that we provide webinar topics that are useful to you as NLAAD partners. So we ask that you, if you have any ideas for NLAAD future topics on the next call, you can go ahead and enter those in your chat box now on your screen, or not your chat box, but your comment box on your screen. You should see something that says submit webinar topics. You can go ahead and do that now. And again, I want to thank you all for joining us this afternoon. We went a couple minutes over, and we also started late. So I want to make sure that we thank you all for joining us this afternoon. We had close to 90 people on the call with us this afternoon, and we hope to see that growing. If you have any questions pertaining to NLAAD or anything that you want support with, we're here to work with you. So go ahead and shoot me an email. You can reply to the email invitation where you got for the webinar, or you can email me at tochoa, TOCHOA, @latinoaids.org, and I look forward to working with you all. So again, feel free to answer those webinar topics now, and I'll leave that running for a minute, but I'll go ahead and end the call now. So we'll be talking soon. Take care.